Hey everybody, it's Devon.
And Kate.
Welcome to Med Crimes. See, I missed the countdown because I couldn't see you.
I'm sorry.
That's okay.
I'll give you more of a verbal cue next time when we're remote again.
I love verbal cues.
I know.
Distant supervision.
Yes, that's you.
Yeah.
Yeah.
So, hi everyone. We're remote.
We missed you.
We missed you all. Kate got to go camping this weekend.
It was so fun.
I worked.
Ew. I did not. Poor Devon. That's the story
right.
of her life.
I promised Kate that this episode was going to be a Devonism and that my life was starting to slow down.
Yay.
And then I jinxed myself. I jinxed myself. And
it's all good.
Yeah. But it's all right. It's fine. There's changes happening and it's all good. Yeah.
Yeah. We're still pulling it together because we love you guys.
Yeah, we are. And thanks for some of the recent love that we've gotten, because Kate and I felt like, you know what? We felt like we were in a, I don't know, do we say we were in a slump? I don't know. We were just thinking we could use some love, and you folks gave it to us, so I appreciate that.
Thank you. If anybody has any more love that they would like to share, particularly on our reviews.
Do we have any new love from Patreons today?
Yeah, we do. We have Terry Freeburn.
Welcome to the family.
Your last name sounds like Freebird, and I love that for you. And we also have Jennifer McVeigh.
Welcome, Jennifer. Oh, I'm loving the Jennifers. We had a slew of Jennifers for a while, and then not any recently.
We did.
So,
any other Jennifers, please jump on the bandwagon.
All the Jennifers.
All the Jennifers. We love you all. You guys are sexy, fierce, fiery sirens that are like singing songs to men to lure them to your fucking cave so that you can murder them. That's exactly how it sounds.
Yes.
Yes.
That's
all you men that are listening are like, whoa, wait a minute. What just happened?
I gotta find her. I have been in a funk a little bit over the last week and a half, and it has to do with the Devonism that you're about to hear.
Okay.
The Devonism episode that you're about to hear is about a nurse, and this all just played out this week as far as her pleading guilty. So this is a fairly recent case, but it's not helping my funk.
Aww.
And I'm in this funk with my mind of like the healthcare field.
Mm-hmm.
And I'm sure I am not the only one out there that is thinking this. Like, you know, I've been doing different roles the last few months, as you know, Kate, and as some people we've said a double duty, whatever. But in that just brings a different level. You know, when you're at a higher level of administration and whatever, it just brings a whole different slew of stress. And I've just been finding like, man, people are in the healthcare industry. It gets frustrating because on one hand, people are so quick to accuse.
Yes.
And
so
people
true.
are so quick to like want to bring in the law.
Yes.
They're so quick to want to point fingers.
Mm-hmm.
So quick for blame.
Mm-hmm.
And what in my mind, the healthcare system right now is like, we want you to do more.
Mm-hmm.
With less.
Yes, exactly. Oh my God, you're so right. You're so right.
And I'm like having this internal struggle. And so even though like non-healthcare people, whether they're families of patients that we care for or our patients or whatever, that are wanting to, you know, in a way it's like, okay, they're advocating for themselves to make sure that they're getting great care, which is wonderful.
Right.
But it also just seems like every single day you go to work, you're covering your ass. That's
so true. And I think all of us that have been in healthcare for any length of time have felt that, like that sort of internal dialogue and that internal struggle with the healthcare field in general, and how at times it is such an exhaustive, soul-sucking, thankless job. And often not is it only thankless, but you're being scrutinized and And maybe the content of this podcast doesn't help very much because we're highlighting all of these terrible, terrible people that are obviously in the field for every wrong reason. And the vast majority of us are doing this because we genuinely love to help people, but it comes with so much red tape.
So like I'm struggling, right? So like it was the first week in a while that I was like, hey, Kate, you take this 2 weeks off. Like I got this next episode, right? And, you know, so I'm having just going about my business, whatever, and just feeling like, man, it's just like no matter what you do, it just doesn't seem good enough.
Mm-hmm.
But then I'm writing this case on Eyvette Hunter right here. It's just a story where it's just like, y'all are making us look bad and you're wanting to make the good ones like just pull our freaking hairs out.
It makes the rest of us look, you know, it casts us in this light when it's like, that's not the case. Like we're all really good people.
It makes our customers, it makes our residents and our patients and their families like watch everything that we're doing, which they should, right?
Mm-hmm.
Right. But it just adds this like nursing is supposed to be the most trusted profession. Yet nobody trusts us.
Nobody trusts anybody right now. I think it's just, you know, this is part of the industry now when, you know, everybody has all this science, you know, and Dr. Google at their fingertips and literally in their back pocket.
And I don't blame them.
I'm not discouraging anybody from doing that, but also please be kind to your fellow healthcare workers because we need it. That's all.
You know, so I bring this up because like I had been having this internal struggle with myself all week, right?
Mm-hmm.
And I've been having the struggle, and it's so relatable to what we do because it's not helping that we have a show called Med Crimes.
Yeah, I know.
I mean, it's just, you know, I mean, how many times did I say to you in the last few months, I can't be an interim director of nursing and a co-host of Med Crimes at the same time. It's just too much for me.
It's too much.
Know?
Yep.
Yeah, because everything you could just be dealing with one minor issue and my brain is just spiraling on the other end.
Yes.
So stressful. But then I had a moment today and I was like, okay, this is why I do what I do. Because I don't know if it will be the last conversation that I have with this girl. This resident, this patient is not doing fairly well. So I had in most of the day, not very alert, not very talkative. However, for a brief few snippets of moments, I was able to see her, have a conversation with her. She woke up enough, and she commented and she said, "I love your shirt." And I was wearing a work shirt. So she saw the logo that was on my shirt, and I said, "You do love my shirt? What does my shirt say?" And it said the name of the facility that you and I work at. But her response was my home. It says my home. So it was such a good moment. So I was like, okay. So having this week where I'm like, why am I a nurse again? Why did I choose this field? Why didn't I go to like office clerk or something? Like, I don't know. But then to have this moment with this person, I was like, okay, this is why I do what I do. This is going to get me through. So I'm so glad
you had that moment when you needed it.
Yeah, I wanted to just have that conversation with everybody because I'm sure everyone out there is feeling this funk every now and again.
Oh, yeah.
I read an article the other day that the state of New York by 2030, which sounds like way in the future, but is really only 7 years.
It's like tomorrow.
7 years away. Oh. In the next 7 years, so by 2030, the state of New York is going to need 40,000 more nurses.
Oh, wow.
40,000 in the next 7 years. Where are they coming from? But like it's like the state of New York is in a panic on how they're going to get that many nurses in the next 7 years.
That's so sad. And I think, you know, all of us, you know, when we have that moment of, God, why am I even in this field? And like, why do I do this to myself? It's so much more torturous. And then we have sort of that moment where we're like, okay, this is why I do what I do. This is what I truly enjoy with every fiber of my being about this. And these are the moments that make it sort of worth getting through all that bullshit. I'm glad you had it when you needed it.
We're gonna roll we're gonna roll out of my funk since we got to explain that to everybody, and we're gonna talk about what you're all here to listen for.
Woohoo!
And you'll just kind of see where it's like yet again another people that are making us look bad.
Ugh.
So this is the story of Eyvette Hunter. And I don't have to use the word alleged in here, because she pled guilty this week.
Yay.
So we will get to that. So,
Okay.
she, as far as I'm concerned, did what she did. I wish I could tell you why, but I'm mad at her.
Okay, I will be too, I'm sure. Let's do this.
She's not a fan of mine. So she's 52 years old, and she was accused of killing a 97-year-old patient, who died as a direct result of her medical maltreatment.
Oh.
So she is or was a registered nurse working at Baptist Health in Lexington, Kentucky. That's a roll off the tongue.
Lexington,
Kentucky. So at this point, writing the story, it was allegedly that she gave a medication that she was not prescribed. But again, she pled guilty. So, there's reports that the patient died, as a direct result of this. And so here we go. This is in 2022, April 30th. So we are just shy of a year ago. Just shy of a year ago, according to an investigation, Eyvette Hunter had administered lorazepam intravenously through IV through your veins.
I heard about this. Oh my God. Okay, go.
Did you? So it's a medication that's commonly used to treat anxiety to Mr. Morris during her shift. So he was hospitalized. He had been admitted to the hospital after a fall at home with an injury. And so during his hospitalization, he had been noted to be aggressive, have some agitation, kind of delirious. I don't really know the nature as to why. Could it have been pain meds, that was making him this way for dealing with his injury? I'm not sure.
Could have even been just the hospitalization in the elderly
absolutely.
Can cause just hospital-induced delirium, plus the medications.
Absolutely.
Yep.
Absolutely. It could be a whole mix of stuff. So Eyvette Hunter had requested during her shift to the physician a medication to help with his agitation and restlessness, but it had been denied. For whatever reason, the provider had, decided it was denied. So apparently that wasn't good enough for her.
Oh,
she had gone into their medication system. We've talked about these before, most likely Ep7, and had gone under another patient's profile, and was able to pull out IV lorazepam. So she went into a whole patient. They called in the court documents, they called this one patient B. So she had gone into that patient's profile to be able to unlock, I want to keep saying Omnicell because that's what we use, but to unlock the Ep7 to get the vial of lorazepam. At this point in time, another hospital employee, a coworker, had seen what happened and said, "What did you just give Mr. Morris?" This resident's name is James Morris, and her response was something special.
Oh,
I'm thinking, yeah, okay. This also, for anyone, again, in the healthcare field, anytime you're talking to your coworkers and whatever, and you're like, they just need a little vitamin A, they'll be fine.
Yes.
This makes me think twice before ever saying that again. So her response to her coworker was, "Oh, I just gave him something special."
Wow.
The medication was given to Mr. Morris. And at this time, the medication did as it was intended. It calmed him down. However, this made him overly sedated.
Oh, dear.
So he became overly sedated from this dose, that was having more of an effect on him than just relaxing him. He was out of it.
Wow. Can I ask one more time? I'm sorry, how old he was?
He was 97.
So if I could offer a little snippet.
Yes, please do.
Most likely a part of the reason why the provider said no thank you when she asked specifically for Ativan is because that class of medications, benzodiazepines, is actually very dangerous in that age group, in that population. They are very prone to having adverse reactions and adverse events related to benzodiazepines and can be very, very, very sensitive to, the central nervous system depression that comes along with that. So that's probably part of the rationale and why she got the no initially from the provider.
Here's the rationale from our provider here. Thank you. Our own original MedCrimes provider.
Thank you.
Shortly after he had been given the medication, his breathing became shallow, labored, and his oxygen sats were starting to go down. Because, again, the medication was doing what it was supposed to, but highly sensitive to this elderly population, like you had just said. I guess it had been noted also during this time because I found it later on when I was reading the Board of Nursing reports that the machine to monitor his vital signs had become disarmed. So when his oxygen saturation was plummeting, there was nothing to alert the staff.
Do they know how it got disarmed? Was it on purpose, or are you getting there?
I'll get there.
It was on purpose. Anyway, continue.
I'll get there.
Okay.
So after this medication, shortly a couple of days later, Mr. Morris developed pneumonia. And it is suspected that it was aspiration pneumonia because he had been giving oral medications after this point, and so obviously he became the point so sedated that he couldn't swallow. So he developed aspiration pneumonia and was quickly released into hospice care and then passed away on May 5th.
Oh wow, that all happened pretty quickly.
It was very quick. It was one brief act, and then it was like, here, he's restless. She decides on her own to give this medication, and within, there's April 30th to May 5th, he's gone.
Wow.
And so as I was doing I just wanted to just do a little bit of research on him, and it really touched upon me because Mr. Morris, James Morris, so like I said, he was 97 years old when he died. So he was a veteran, and he was a World War II vet.
Oh, you're kidding.
And there's not many of them left.
No,
there are not many of them left. And it's really like I have this focus lately on World War II because my grandfather next week he is a World War II vet, and he turns 100.
Oh my God! Wow.
He turns 100 next week. So. It's
that's
like
the age group that they are. Like there literally are so few of them left.
Yes. So had this gentleman been able to, potentially be 98 this year or be still here if it wasn't for Eyvette, going outside of her scope of practice. So I just wanted to mention that tidbit because,
it's very important. It shows
very. Yes.
People that are World War II veterans and their families are, very proud of their service, and they should be. So I think it's absolutely worth mentioning.
When we post for our socials on there, it was very easy to find his picture with his obituary, and he just looked like the sweetest little gentleman. Oh, I loved him. Oh. I saw his picture and I loved him.
Devon's in love. Oh,
goodness. I am. So like I said, it's a quick this week. It's a quick story, but it just really pissed me off.
Absolutely.
So I'm like, there's just, So after this had happened, about 2 months after his death is when the police were started investigating. So she was suspended. She was terminated from the hospital immediately, the same day as the incident. And then it got reported to the Board of Nursing. Attorney generals then got police involved. So it took a little bit as far as for police to start investigating. So the Lexington, Kentucky police started investigating within 2 months. And the hospital, fortunately, I know a lot of times we read these things and the hospitals are not cooperative. This one fortunately was.
Oh, good.
They were not trying to bury anything.
Fabulous.
So she was terminated on the same day of the incident. But I guess also at this time, so she had gone to work for this place on her own, but simultaneously she was also employed through a travel agency. So, so she was not assigned to Baptist Health through the travel agency. She had done that one on her own. But when she got terminated, she began working at University of Kentucky Healthcare. Which is like a slew of, it's like a, almost like a UMass type of health, where there's many different satellites. Yeah. So she had been working for the University of Kentucky healthcare system through the travel agency. Now, the travel agency didn't initially know anything until she was arrested. And I believe she was arrested in August. I'll get to the official date later. But so from April, she was terminated on April 30th. So she still worked from May 1st through August. So the few months. So the police started investigating 2 months later. So they started investigating in about June. And then she got arrested in August. So it took a little bit. So fortunately, there was no other incidences that have been reported at any other time she was working as a nurse. Which is good, but
Yeah.
Go ahead.
And sorry, can I ask, and you might have said it and I might have just missed it. Did you say that nurse that had asked her, what did you just give him? Did she report that, or did, like what?
She did report it. She
Okay.
did report it, and that's what, there was a few different things, and I'll get to it a little bit later.
Gotcha.
But
I won't
so there
jump
was
the gun.
That's okay. There was a few different things that like led to like what happened for the hospital
Right.
to terminate like right
Yes.
away. And it's really written pretty officially in the Board of Nursing report for when
Gotcha.
they took her license. So yeah. So the travel agency, when she got arrested, the travel agency relinquished her from their company. And they wrote a statement saying that we are saddened by the recent tragedy and we send our thoughts and condolences to Mr. Morris's family and friends. The incident took place at Baptist Health Lexington, where Miss Hunter took employment on her own and separate from our health carousel. After we were informed of the incident and subsequent decision from the confidential board investigation, Miss Hunter was immediately released from her duties with our company. I wrote that here just because it's so important. We've done so many things where it's like people didn't do their due diligence. We've done so many stories where either the hospital was burying it, or especially with travel agencies, you see them making like these things like here, a little bit here, a little bit there, a little bit here, all adding up to like this big mass murderer, right? This didn't seem to be the case. Like she was really just kind of rogue, did this one-time thing, and it killed him.
Wow.
But this one-time thing was huge. So I was happy to see that the hospital did their due diligence. The travel agency was like, yeah, no way, like you can't work for us anymore.
I gotta say though, with an act just so blatant and just in front of other staff members and being so noticeable, and having it be noticeable enough that somebody reports it, I would be very surprised if this was her first time doing something like this.
I know. Yeah.
I mean, she just seems so comfortable doing that.
Yep. Yep. And because it is still so new, like we're only within the first year, we might hear of some other things coming down the road. And if there are, like, then that's certainly an opportunity for an update. But like, so this is only a year ago.
Sure.
She had only been, so his death was just shy of a year ago. She got arrested in August. We're only in April. She just pled guilty. So it's like, okay, so we might start seeing a little bit more coming out and about. So,
and it might not be that, she's killed other people. And it might just be that, she's given medications without orders to people in the past and gotten really lucky and not had anything really bad happen up until now. And now someone's dead and she has to answer for her actions.
So the statement from the hospital after her arrest was, we have learned that a former nurse at our hospital has been arrested on criminal charges. Again, this is in August. The nurse has not worked here since April 30th. The nurse was terminated and was reported to the Kentucky Board of Nursing. The hospital was fully cooperated with the police investigation. Patient care and safety are always our top priorities. Out of respect for the family and because this is a criminal matter, we're not able to talk further about the investigation. So I wanted to read this because also like the next part that I'm going to mention, like there's times when I fully believe that hospitals use a nurse as a scapegoat. If there's like areas like of,
oh, sure. 100%.
gross misconduct on a hospital end or whatnot. But I truly don't believe in this one that it was the case. I mean, it's way too blatant.
Yeah.
But so I guess her attorney, when she was arrested, I think I read August 23rd. So when she was arrested and she was brought to court, her attorney was saying that that she was being used as the scapegoat for negligence at the hospital, and I'm like, I doubt it. Like unless, I mean, obviously there's mistake. Like we've talked about Redonda Vaught. I fully feel like she was used as a scapegoat because that was an actual mistake. Yes. She did the override and took the wrong vial, didn't do the checks on her part. But the difference here is Eyvette went into a different patient's record to get a medication that she had already asked for and was denied.
There was fully intent. Exactly.
Yes. I'm
that
like,
was not
no,
an accident.
I'm like, this one, no negligence on the hospital part. Yeah. He's also saying like, okay, so she's being charged with murder. So she's being
Yes.
charged with murder, but no doctor specifically saying murder. I'm like, okay, no one used the word murder by a physician, but they're saying that he died as direct result of what happened.
Yes.
They were, step one was giving the medication. He might have died from aspiration pneumonia, but he got aspiration pneumonia because he was sedated. He was then giving something he couldn't swallow, got the infection. He's 97. He passed away.
Exactly.
So the attorney, I'm a little like, you're kind of sleazy, dude, in my opinion. So his statement was, what I have learned about the criminal justice system, prosecutors can make anyone a murderer. When you're facing 20 years to life in prison, you sometimes have no other choice but to resolve your case and take a lesser charge, even though you are innocent. I call bullshit.
Yeah.
I'm like, no,
you're
dude,
very right.
I call bullshit. So, because of that, so like the judge was originally going to set trial in June. So they were like, okay, we're gonna get professional medical experts in here that, to prove the case, all of those things, and set the trial for in June. However, she went into mediation. So she had gone into mediation and the charge was changed to second-degree manslaughter. And that is what she has pled guilty of.
Okay.
So she's pled guilty to second-degree manslaughter. There's a recommended sentence of 5 years and another condition that she may not practice in the healthcare field again. So, okay, fine, you shouldn't. I feel like she should be in there for a lot longer than 5 years. But we won't know officially until June 8th. June 8th is when she's supposed to be sentenced. So right now she has taken her plea deal of a lesser charge instead of murder. She's taken the plea deal for manslaughter and has pled guilty. So according to what the Kentucky Board of Nursing has, so she did have states and other licenses. I think she had a compact license. She had been a registered nurse in Kentucky since 2018. But had also been an LPN since 2007. So she had 15 years under her belt in nursing before she even did this. So I would like to know if things come out further that there's, more questionable choices that she had decided to do throughout those 15 years. So according to the Kentucky Board of Nursing report, the events came out as followed: that Eyvette Hunter appeared in Mr. Morris's room several minutes later with a syringe and proceeded to administer something intravenously. After that, Morris had become sedated. Another hospital employee saw what happened and asked Hunter what she gave Morris. Hunter answered, "Something special."
Ugh, that's just makes my skin crawl. Something special. Ugh.
She was late. So Morris was later found with labored breathing, oxygen saturation equipment turned off, and it was determined that the respondent had disalarmed and lowered the oxygen monitoring system several times as to not set off an alarm at the bedside.
On purpose. Like she did this.
Yep.
Didn't just like silence it.
Yep.
Like just shut the thing off.
Yep. So the document indicates that Morris had aspirated on food or medicine that was given to him. As a result of the incident, he developed pneumonia. He went into hospice care on May 3rd and died 2 days later. Despite the rapidly declining condition of the patient, the respondent, being Eyvette, never called for rapid response nor acted with any sense of urgency.
Wow. Because she knew, and she was like, I'm hoping that he just kind of wakes up and turns around and this all goes away.
Or maybe she's just hoping maybe they'll think he passed in his sleep.
Yes. And like, how would they know that I gave him something special?
And then it says that the respondent did, however, edit documentation of administration of Ativan on patient B to state not given. So she turned around and she went into the Pyxis to state that she was taking out Ativan for patient B, and then she had changed her documentation that she didn't give it to that patient.
We've talked about this before, but when you take a medication out of these drawers that are directly linked to your medication administration record, it kind of creates an administration for you to document on within the medical record. So the medical record of a patient knows when you withdraw a medication out, even if they don't have an order for it, so that you can then go document on it. Does this automatically without a doctor even entering the order. So when she took out this Ativan for patient B, it created an administration under patient B's record that she then had to go and edit and say not given. So I'm assuming that she documented absolutely nothing for the guy that actually received the Ativan, because there was nothing to document on because she gave it to a different person.
Mm-hmm.
Wow.
So in the nursing report for her order of suspension of her nursing license, it does say that she admitted she had given Morris Ativan without an order, as well as then subsequently feeding him. So she's admitted to all the steps that led to his aspiration pneumonia. Do you want to quickly explain for some of our non-clinical people aspiration pneumonia versus regular pneumonia?
I would love to. So, I mean, there are several different types of pneumonia. Our sort of basic or most common type of pneumonia is something called community-acquired pneumonia, which is just pneumonia that you get, from like walking around in the community. Due to a viral or bacterial infection, it creates this like sort of cluster of really clogged up little tiny sacs in your lungs and make it really difficult to breathe and make you cough a lot and make you cough stuff up. And if it's bacterial, it can be treated with antibiotics. Now, aspiration pneumonia occurs. It's a very specific type of pneumonia that occurs when somebody's either food or medication or gastric contents end up, instead of going down our esophagus, end up going down our trachea. And this is commonly happens if somebody is sedated for some reason, or if they have dysphagia or like a natural, inability or difficulty swallowing. It can sort of mistakenly spill over into the lungs. And that creates a very specific type of pneumonia with a specific type of pathogen that's all like, gastric bugs. And it can be difficult to treat, and it can absolutely be fatal in somebody of this advanced age.
In layman's terms, whenever we're choking on something, we go, oh, it went down the wrong tube.
If it really does go down the wrong tube, yes, and it will land in your lungs, and all of that food and gastric contents contains bacteria that really the lung tissue is not prepared to deal with. So that's what creates that infection.
So I thought it was interesting a little bit as far as like still being able to work while under investigation with her license and whatnot, because it had been reported to the Board of Nursing. So the Kentucky Board of Nursing disciplinary process, nurses under investigation are allowed to keep working with the details of the while the details of the investigation staying confidential until there's a resolution. So it sounds like the Board of Nursing for Kentucky kind of goes with innocent until proven guilty. They're investigating, but until it's proven guilty. The policy does say that the board is able to confirm whether or not someone is under investigation if an employer asks. So they'll let somebody know that they're currently investigating, but not whether like you've been suspended or not yet, because you haven't. Right. But in rare cases, the board can take unilateral action to suspend a license immediately to protect the health and safety of the public. So obviously, like right away, they will do one.
Right. And so if it's like an immediate threat, they will do it.
So as soon as Eyvette was arrested, so again it was from April 30th, not arrested until August, late August. Right here, August 22nd. So when she was arrested, then she was able to still work, even though the Kentucky Board of Nursing had been notified of it. But as soon as she was arrested, they had issued an immediate suspension order. So then it was done. Your license is suspended, even though you haven't been proven guilty yet. But because they had enough to arrest.
Bye, bitch.
Yeah. So the time frame for all of this, I thought was interesting. I mean, it does seem for some, it's like when you just see. We talk about some things and how it takes a really long time.
I was just going to say, this seems like they really got it together, they did. Very quickly. Good for them.
They did. So the board finished their investigation on June 14th. So he passed on May 5th. They finished their investigation on June 14th. They went to her for a response. She admitted it on August 5th. And then she was arrested on August 22nd. So everything was wrapped up, and part of me, I'm like, good for you for admitting your mistake. But I mean, part of me is like, okay, I'm trying to put this in a devil's advocate, situation. Like, were they short staffed? How many patients did she have that night? Was she worried he was gonna fall? Was she? But
not
no.
an excuse.
No, it's not an excuse, but it's also, we know in relation to what nurses are feeling sometimes. Like I said in the beginning,
I understand.
Was she in a rut too?
Stress.
But even though I'm in a rut, I'm not going to give something to someone that I don't have an order for. Kate, you won't give me this order for something while we're at work, so I'm going to go ahead and do it anyway. How would you feel about that?
I feel like it's one thing to, and I've never done either as a nurse, but I feel like it's one thing to give a medication, based on your assessment without an order, without talking to anybody. And then there's this whole other category of you've been literally instructed specifically to not give this medication to this patient, and then you do it anyway. That's like taking that to a whole nother level. Level.
And you know what? I'm happy that she's at least like, yep, I did that. Yep. I did that. Like, okay, fine. Now you're going to have to do your time. The difference in this one where, Redonda Vaught had admitted once she realized her mistake, she had admitted everything that she did, and was cooperating with everything, but it was a flat out mistake. There was no intention.
It was.
There was no intention. And that's why she hasn't. Yep.
Right.
So even though she was found guilty on her charge as well, even though she was like, I'm not going to plead guilty because for what the charge was, I forget what it was. But even though she was not pleading guilty, like Eyvette here is, hers was a true like first time nurse made a mistake. This is a nurse blatantly being like, I'm going to give him this medication, and I'm just going to do it. And here we are 5 days later. So
wow, wild.
Yeah. Yes. So I'm going to keep thinking of my moment with my resident earlier today, because now that we finished the story, though brief, I'm back in my funk. I'm back in my funk. So
Devon, get out of the funk. Listen, let's all just me and Devon are taking this opportunity to remind healthcare workers out there, be kind to your coworkers, be kind to other people. If you see a healthcare worker out there that's a colleague of yours that seems to be struggling, like reach out, offer kind words, give advice. Let's all just like lift each other up, because it can feel steamrolling being in this. And I
think it's also okay that if you are having a funk like I am right now, like I think it's also okay. I think it's okay. Like the profession that we chose is hard. The profession that we chose is grueling. And, we all kind of expected to work long days and, there's a lot of things that you expect when you go into nursing school. But you just have to also keep in mind the things that keep you going. And why you do what you do.
Let's normalize talking about, the parts of healthcare that just make you feel that way.
Absolutely.
Let's normalize being okay to not be okay. And I mean, lift each other up. I think that's a good thing for me to summarize it with. I'm not okay, and it's okay. It's okay not to be okay. It really is okay. Yep. Oh, guys. Well, we hope that you are all okay. And if you're not okay,
it's okay. It's okay to go, why did I do this? And I'm still paying my student loans for it. Like, what?
I know. Why am I still paying many $100s a month so that I can go to work every day and feel like this at the end of the day? But hopefully the good is still outweighing the bad for most of us.
It did for me today. I mean, there's a very good chance that could be the last conversation I have with this person.
Sure.
And I'm okay with that. The conversation that we had today, like it was a good one, and it makes you remember why you go to work every day.
That's right. That's what it's all about. That's why we do what we do.
All right, everyone. Thanks for listening. If you want to keep listening and hearing from us, you can follow us on Instagram at MedCrimes Podcast.
You can tweet at us at MedCrimesPC.
You can search us on Facebook at MedCrimes Podcast.
If you wish to join our army of, what are they? Sirens. Our army of sirens. You may visit us at www.patreon.com/medcrimespodcast.
We have a lot of Patreons getting their t-shirts, and they're very happy. We have one Patreon, I was told this week. She said to me, I was your very first Patreon, and how come I don't have a t-shirt? And I said, honey,
the links are there. Just
the links are there. Sorry.
All you
Anyway,
have to do is be a Patreon for a couple months. You get a free T-shirt. You should come check it out. It's a pretty sweet deal. I don't even have a free T-shirt. I had to pay for my T-shirt. Okay, let's be honest.
Same. And lastly, if you want to be part of our next episode of Break Room Banter, do you have a funk story to share? Do you have any?
Please.
Do you have any moments that get you through your funk that you want to share? Then you can
that would
reach
be really
out
helpful.
You can reach out to us at medcrimes@gmail.com.
We are getting a few more stories trickling in and are hoping to do Break Room Banter Volume 2 very soon.
Yes!
And if you want to maybe make the episode, give us a crazy, messed up, wild, uplifting, feel good, feel bad, whatever type of story you want to share. We want to hear it.
Yeah, we do. Thanks for listening, everyone. I hope you enjoyed your Devonism microdose.
Stay safe out there.
Toodles.